Hey, Dr. Rob.
Good evening, Tammy. What's happening at your end of the world?
It's warming up. I live in Arizona. It's toasty. But let's talk about before we get started. It's Super Saturday Recovery Summit again this Saturday. So that would be June 20th on intherooms.com. It's free. We've got Dr. Stan Tatkin, Dr. Jamie
Amazing.
Marich, yes, and Eddie Caparucci, who does a Wednesday morning once a month. In fact, he'll be on this week, Wednesday, doing his webinar. Great guests. I'm so excited. And Dr. Rob will be introducing Dr. Stan Tatkin, who has done a podcast for Dr. Rob on the Sex, Love, and Addiction podcast series called We Do. But tell a little bit more about that, and then let's get started.
You mean about what's going on this weekend?
Well, about you know, Dr. Stan.
Sure.
Yeah. What?
So Tammy and I know people. We've been doing this a long time, and so we are pairing up with intherooms.com because they have like 200 12-step meetings, that you can go there for. It's on their server. We don't offer that, but we do offer them some support around intimacy and sexuality. We thought, why don't we put together a series once a month of people we know who can talk on this stuff? So I think we had one in May, right?
No, you started in April, and then we did those.
April, really?
And,
so this is number 3.
It wasn't we did this. Dr. Rob had this idea and brought it to the In the Rooms group because he's been doing an In the Rooms group every Friday night for nearly 4 years. And it's a huge meeting. That one has
270 people on every Friday night.
Yes, and so it's a great resource, but we've collaborated. Seeking Integrity and In the Rooms have collaborated, and I have the honor of hosting the sessions, which has been a delight for me. So I'm there once a month doing that. So,
but Tammy wanted to mention Dr. Tatkin. So we have invited, I think, one of the most acknowledged professionals in the area of relationship intimacy and attachment. He's really one of the mucky mucks at UCLA who writes all those fancy books. And he's also a colleague. And I wrote Predependence, for those of you who know that book, in relationship to his work. I think he endorsed it. But he's not boring. He's a fun guy. And his focus is relationships and why we're in them and what they mean and how we can make them better. And he's just an amazing guy. So that's my contribution to next weekend.
Well, and his We Do message really is timely. We thought how we do when we all need to pull together and support each other, made a lot of sense. So anyway.
Well, the basic message of that, I'll just say, and Tammy loves this, is that, when we're in an intimate relationship and we make a decision, whether it's for ourselves or for the relationship or for anyone else, for work, is that decision, I have to ask myself, is that decision a good one for my relationship, rather than is this a good decision for me? Because I'll always find something that I want to do. But if you're focused on a relationship, keeping that partner in mind when you make decisions, and of course the opposite, which is addiction, which is I'm going to make decisions I'm not going to tell my partner about because I want to do them, is the opposite of relationship building. Very good stuff. And he wrote this book called We Do, which is about why people marry and what marriage means. And anyway, good book, good stuff. He'll be on soon.
Yes, excited. Okay, so our first question of the evening, can you please provide some information about the connection between sex, love, addiction, and dissociative disorders?
So dissociative disorder, by the way, I should take my pen and paper because I'll forget things. Dissociative disorders, so there are different kinds of dissociative disorders. Some are related to biological things, like someone might have depression or anxiety or schizophrenia. They might have something that might lead to some kind of delusional disorder or dissociative disorder. But the way we think about them in the trauma and addiction world is that many of us learn to, so let me go back a little bit. When you're really little, like before 6, you don't have a lot of support and a lot of places to go with pain. You only have your caregivers. That's all you got. And if they're unresponsive or unavailable, who do you turn to? Where do you go? Where does a little kid? And it's not like a little kid says, oh, I get it. Mom's drinking and dad's overweight and they hate each other. And that's why I'm not getting love. A child says, what's wrong with me that I'm not getting love? So the only conclusion for a child is, I really need to find a way to make myself feel better because I'm not getting support and I don't know what to do all these feelings. And so, for example, I dissociated by, I remember when I was locked in my room as a kid and my parents were screaming in the next room at each other and I couldn't get out of my room because I wasn't allowed. I I had this little notepad. I don't know if I ever told you this, Tammy. And I used to look at the cars that were out the window, and I had lists of them, like, and of course, LTDs and Falcons and Thunderbird, you know, and I wanted to be able to tell by the taillights what kind of car it was. And I used to check them off, and oh, I saw that one. So even though you might think I was present, what I was doing was I was finding a place to go out there on the street where I felt clever. I felt like I could figure things out. And it was like a little way to feel good about myself. But I wasn't really in the room. I wasn't, you know, I was out there night after night with my pad. Now, there are more extreme forms of dissociation where people can develop other personalities or completely space out to the point that they don't remember what happened and they don't remember where they were. Most often, these things are tied to trauma. So I do believe, absolutely, that process addictions, for sure, are very, very closely related to dissociation, if not a dissociative act. Because dissociation is about spacing out, using fantasy to feel better, disappearing. Well, when I am driving down the street and I'm thinking about hooking up with a sex worker and I've got a few hours free, my neurochemistry is pushing my head right out the door, and I'm in this state of kind of arousal, not sexual, but emotional arousal. And I'm really excited about something, and it's not anything that's present, it's something I'm looking forward to. So in that way, it is dissociative because people are spaced out, they're not present, they're using the experience to disappear into, but it's not how people would typically think of dissociation, which is more like a PTSD. Like, you know, you were abused in some way on a street, and then someone starts coming up to you on the street and you just disappear, space out, you know, that's more traditional kind of dissociation. But yeah, I think the stuff we do in sex and porn addiction, highly dissociative, but they wouldn't think of it that way.
Okay, next question. I am a gay man with a long history of sex addiction as well as meth. In my sex addiction, I have no interest in porn, masturbation, voyeurism, exhibitionism, threesomes, or orgies. My acting out involves one-on-one sexual encounters with many other gay men. I do not have any interest in reaching an orgasm when I'm acting out. Is this sex addiction or addiction to validation from other men?
Did I just think about meth or drugs, or is it just about sex? I just want to make sure.
I am a gay man with a long history of sex addiction as well as meth. Yeah, so meth is in there.
Okay, so first of all, if you were a gay sex addict, male, I wrote a book for you. It's called Cruise Control, Understanding Sex Addiction in Gay Men. And I think for any man who wants to understand, how do I find what is healthy sexuality for me in a community, the gay community, which is often very sexually liberal, not good or bad, but if you have a problem, it's like hanging out with people who drink all the time. You don't know if you have a problem or not because everybody's drinking. So I wrote a book and then revised and wrote it again, 2005, 2013, because I had to add marriage and meth. And the other issue is, though, about meth. So our treatment center at Seeking Integrity, this is what we treat. And I just want to say that because I've worked both with drug and alcohol issues and sexual issues. And my experience is, and I'll talk more about that in a second, that if you truly have a problem where you're combining sex and drugs on a regular basis, then you have a sex problem. And it doesn't mean you don't have a drug problem. It just means if you go to a drug and alcohol center and they help you get sober on drugs and alcohol and really give you all that support and knowledge, but no one has talked to you about your history, your family relationships, you know, trauma, or what your sexual life has been about, you're going to relapse. And so for some people, they are very much co-occurring. So sorry, my Vince Giraldi phone. For many of us, they're very related. So I'm sorry, Tam, there's more I wanted to say about that. You have some thoughts? I've interrupted. You never said anything today.
No, I'm saying, I'm taking it all in. So, but he's questioning, you know, is what I think is interesting is the sex addiction or addiction to validation from other men. So can you talk about that?
Well, I don't think anyone's addicted to validation. I think we want it, we desire it. And of course, what's wrong with wanting to be validated, wanting to be loved, and wanting to have someone around? But I'm not sure that has anything to do with drugs or having sex with strangers. Just because you have sex with one person at a time, so you have one drink at a time, you have one hit of cocaine at a time. But, you know, some people binge and some people do it all the time. But the issue is the same. You end up alone. You're objectifying someone, maybe partially for sex, but maybe with a fantasy that some romance is going to develop, but you don't know who they are. You don't know who you are. It's never going to work. So I was going to add one more thing to this thing. When you're doing meth, because of the way that drug works, you may not desire orgasm, or you may not be able to have them, but the sexual fantasy and the sexual arousal is still running. You need to remember our sex organs are not between our legs, they're in between our ears. And so if you're taking drugs, you might very eagerly be pursuing all kinds of sexual behavior, but you may not fully be able to enter it, and that's fine. You know, I've seen guys on meth sitting around looking at porn, they're not actually doing much. But there is one more thing. A colleague who works with us, Dr. David Fawcett, he's the drug part of our drug and sex program, where it's just about drugs and sex. He wrote a book called Lust, Men, and Meth. And I think that that's a really important thing to look at. In other words, it really explains the meth issue. It's sort of like cruise control. You'll get it right away. So let's go back really quickly. We all have a need for validation. We all have a need to be loved. But if there's something about ourselves that we feel is unlovable, or we're ashamed of, or we don't deeply believe that we are deserving of love, or we don't believe that others will respond to us in loving ways, then it's a lot easier to use drugs and have sex and feel the illusion of being loved, the illusion of connection. Because when we really connect with people in a deep way, when we're sober, that's scary. That's like, oh, I could get abandoned, I could get let down, I could get hurt. So even though you may say, well, I want to have something meaningful, nothing about your behavior, I would say to you, why aren't you actually doing that? What you're doing is having control over how you get those needs met. But being ashamed of the needs, what's wrong with me that I need so much, is not the answer. It's finding a healthy way to embrace those needs that is the answer.
And I was thinking that there's the comparison of, well, I don't do these things, so I'm not that bad. But that's like, you know, somebody drinking and going, well, I only drink beer, so I can't possibly be an alcoholic or whatever. So I think those kind of comparisons are less helpful. I think really understanding, you know, how you feel, what it's doing, how distanced you are, how alone is what, you know, when Dr. Rob said alone, I thought, you know, that, yeah, I mean, a bunch of revolving door, you know, sexual acts is not a connection with a meaningful connection with somebody, you know, that you can have a conversation with too. So
we have a saying about this. It's when you're longing for connection, but you turn to casual sex and drugs, it's like eating potato chips when you're hungry. It's never going to fulfill you. It's never going to feed you. For the moment, it will stop that longing to eat, but you're just going to get sicker and sicker if that's all you have to eat. So can we move? I think we killed that question. Let's move on.
Why do you or perhaps other therapists recommend a 90-day abstinence period for couples?
Well, I think there's multiple reasons. First of all, I don't walk up to any client and say, you got to have 90 days. I don't know that any client necessarily can do that or think of that. What I might say is, let's get through a few days and then a week and then a few weeks. Now, your partner doesn't want to hear that, but that's what it is in the process until you kind of grab hold of it. But from the partner perspective, it's a whole different question, because I say this to every partner. If you're here in the room, please listen to me. A lot of partners, so this is the reason why, from a relationship perspective, a lot of times, not a lot of times, but often when partners hear what we've been doing outside the relationship, they kind of get it in their head that, and I think this is, you know, part of how they blame themselves, but they'll say, oh, well, maybe if I've had more sex with him or her, maybe if we're spending more time and having a lot of, maybe if I satisfy them, then they won't run away. And there also is a sense of safety, I think, for the partner in, well, if we're having sex, then maybe things are going to work out. But what I say to you guys is that's not a good reason to have sex with someone. And the most important thing for your spouses, and just really think about this, is why would you have sex with someone you don't trust? So I would suspect that in the first 90 days, if you guys are having sex, you're doing it for the wrong reasons. You're doing it to feel connected, to feel like no one's going to leave, you know, to feel reconnected in this blissful love way like you did at the beginning. None of those reasons are good reasons to have sex. Sex has to do in a long-term relationship with intimacy and trust. And since you guys don't have a whole lot of that, I'm not sure sex is a good idea.
And you've said this before, going 90 days without sex hasn't killed anyone. So
nothing falls off.
There you go. So there's one in the chat I want to read. When is usually the best time to introduce a marriage counselor into the recovery process?
Well, we've talked about this before, Tammy. And, you know, I don't know what this person's situation is or what they're in counseling for, but if it's strictly about, let's say I discovered my wife was a sex addict and she's acting out all over the place, and so we need to go to couples therapy, if that's the question, or husband, whatever it is, girlfriend, boyfriend. a lot of couples will run to couples therapy thinking, well, this will help us fix the addiction problem. We'll figure this out here. And that's not true. Couples therapy is for couples work. First of all, a couples therapist cannot see both of you because one of you is going to tell them all these secrets, and then are they supposed to keep it secret from the other one? And it's just not a good idea in our world for a couples therapist to see either one of you. Their role is to do couples work. Second of all, in the beginning, when you're so angry and so hurt and so scared, both of you, it's very hard to make any real headway in couples therapy. A lot of times your spouses are saying, I hate you, you ruined my life, in various forms over and over. And what we addicts are saying is, I'm really sorry, can I have another chance? And you can do that over and over again, but really recovery is about what you do, not what you say. So in the beginning, when couples are really at a lot of tension, couples therapy in the very beginning, I think, is good to help them set boundaries. When can we talk about this? Because he or she asks me all day long, and I just need a break. What if we're yelling at each other? What if, how do we handle these situations when we're at such a high pitch of emotion? Couples therapy is really good in the beginning for that. What are our boundaries? When do we talk about this? When do we not? How do we keep from raging in front of the kids? How do I handle it when you're angry at me and I don't want to hear it? Those are couples issues in the beginning. But really, most of the work for us has to be done, and for the partners has to be done separate. Because here's the deal. We have hurt these people so badly, our loved ones. Couples work is really going to be about trying to get their forgiveness. And that's not what I need to do. I needed to learn how to get sober and stop acting out and build better relationships so that I have the support to continue in my sobriety. And I cannot turn to my spouse because that's the person I hurt. And that's asking them to put themselves aside to take care of me. So in the beginning, we don't ask couples to put the usual amount of support and direction that they put on each other. We ask you to reach outside, the men to a men's support group, the women to a support group, the men to learn how to get sober if they're the addicts, the women to learn how to tolerate the pain and get the support you need for having worked through this betrayal. Once you both have more strength and a handle on the pain of the moment and really feel like there's progress, there's some sobriety, there's a lot of support, then you may move forward and say, okay, let's get into couples therapy. Sorry about the long-winded answer, Tammy.
No.
The bottom line is couples therapy is about creating intimacy and working through challenges, but you have to get your shit together before you can do couples work. So in the beginning, it's about boundaries. It might be a timeout in the middle, and then it's going back to it when things are better. That's my belief, but another therapist might say something different.
So my SA husband used porn, had hookups with cross-dressers, and also had a 10-year affair. I found all of this. Nothing was ever disclosed. I get addiction, but with the 10-year affair, I so struggle. I read emails that were communicated multiple daily and lots of romance and personal info about our family, her family, and he turned to her with problems and many gifts. They celebrated anniversaries. I can't wrap my head around the fact that this affair was so obviously emotional and was just about getting sex. They were together for almost 2 years without sex. Can you address that? He swears there was no emotional attachment.
I'd love you to start with that one, Tammy, if you could.
Like, there was emotional attachment. I mean, when you're giving gifts and celebrating anniversaries, that's
like, not addiction.
Yes. So, but I hear the hookups, there's lots of stuff in here. And I hear your pain. So let me back up and start with that. I am so sorry, and I can imagine how difficult this is for you, how traumatic this has been for you. And remember, that addicts lie until and unless they get tools to do things differently. So do I think when he says he loves you, I believe he believes that, but I also understand that, like Dr. Rob was talking about with the dissociation, it's like there's this, and then there's this compartmentalized, and then there's this, and just like Dr. Rob was talking about with the dissociation, it's like, if I'm struggling in my reality, I can go over here and I can, fantasize about this and, how great it will be and how perfect, and, that's not reality either. So, but I'm glad you're here. Dr. Rob?
Well, I also feel the pain of this situation, and I only hope there aren't children around watching it, because it can be very heated and painful for them to experience. I said before, love is behavior. When someone has not cheated or broken your trust or let you down, and you pretty much basically trust each other, then words are love too. But when someone's broken your trust, the only thing you can trust is behavior. And quite honestly, I'm thinking, is he still talking to her? What happened to their relationship? How did he treat her? 10 years is a long time. Did he treat her like shit? Because that's how you're going to get treated. By the way, you're not the only one who was cheated on here. So was the girlfriend. You know, oftentimes, and I know you're going to hate this, but I used to, well, Tammy knows this, back in the old days, when we did residential treatment, we're like 20 years ago, we don't do this anymore. We would invite girlfriends and wives because they had the most in common. They were sharing a man who was a jerk. He was a jerk to both of them. He lied to both of them, manipulated both of them. And while they had been angry at each other, how could she do that to our family? How could she not leave him? Whatever. The reality is they have more in common than, like, they've both been wounded, and these partners and these wives would bond. And then by the end of the week, they would just hate the person who had hurt them both. So first of all, I want to say to you, this is not about the other woman. It's never about the other woman. It's about the decisions that your husband made. Now, it does sound just in this situation like he has some sexual problems, for sure. But people can have more than just an addictive problem with sex. They can also have problems with intimacy and relationships. They can have problems with kink and fetishes and orientation. So sex addiction isn't the only thing that can come up when someone is doing this kind of thing. So what comes up for me is, yes, he's probably an addict, but trust your gut here. 10 years of an affair is not an addiction, okay? 2 years and then the next one and the next one, and then having some in the middle, that might be. So I would say there's more than one thing going on with this person, not just about sex, but also about intimacy and relationships and being broken. My question to you would be, you know, what is this person's willingness to heal? Meaning change everything. How much is he, you know, I hear, like, even in your letter, well, he didn't do this, and he says he didn't do that. All bets are off. He could have had sex every day or none. You have no idea anything that he's saying is true. So I'd cross that one off. There's also a lot of things you don't know about. So I think the question for me is, how committed is this person to getting well? Can I live through watching them get well? Can I ever trust them again? You know, the last thing I want to say is, for you partners, you know, when you're going through this painful part, I know how the addicts are. We're like, well, but can't you start to forgive me? Or can't you get over your anger? Or, you know, what about us and what we've always been to each other? And I just stop them, because I really think a partner's job in this moment for the next year for you, you have three jobs. One, to be angry and stay angry for a while. Two, to decide whether or not you even want to be in this relationship. And three, to get a lot of support from other men or women who have been cheated on in your situation. It's not your job to fix, not your job to make feel better, not your job to understand. Your job is to take care of you and just think about your fury, and if you can live with it and move forward. The rest of the work is on the addict.
So I'm going to skip over to in the chat. There's another one. I'm a spouse, married almost 3 years, no kids, 11 months from discovery, that's still deciding whether to stay in the marriage or not, just kind of like you were talking about, and who also wants to go through formal disclosure to gather all facts before making a decision. Currently, my husband and I have our own therapists and attend our own group and therapy sessions, as well as SAA and COSA. My husband insists on having a marriage counselor present for disclosure per the advice of his clinicians and fellow SAA members. Should we start seeing a marriage therapist even if I choose to leave the marriage?
I'm not sure I fully understand the question, because I'm not sure who's, like, if someone's recommended something, then I'm not sure. Can you help?
Okay, so here's what I think I'm reading. Like, it sounds like, well, I want to just make sure. So if both of your therapists are going to be in the room with the formal disclosure and then they're adding another therapist, that seems unnecessary. So, like, as long as you have both of your therapists there and the process is really specific, you have the plan, you know, like, you don't need a marriage therapist, in my opinion. You do want a therapist, but what I really caught on to was, you're still trying to decide whether you want to be in the marriage. That's fair. If you absolutely are out the door, then formal disclosure is not recommended for lots of
reasons. Doesn't happen.
Yeah, well, most of the time, there's always exceptions, but yeah, most of the time it doesn't happen. But if you're still deciding and you're still open, you know, Dr. Rob talks about, you know, a disclosure is so that you can get a foundation on which to build, and there can start to be healing. You know, if that isn't part of the path, you know, then there's no need to do a disclosure, even though you deserve to know, you know, all that but regardless, to me, what I'm unclear about is, are you talking about having 3 therapists in the room? That seems unnecessary.
Well, I just want to weigh on that briefly, Tammy.
Uh-huh.
Thank you. So what I hear in this is that the therapist, I'm not sure that you're seeing or the husband seeing, one of those therapists feels uncertain about what's happening. And it sounds like they're, oh my God, it's going to be this or that. We better get a couple of therapists in there. I'm not sure. Like Tammy said, if your therapist there, his therapist, that's, you got support, he got support or whatever. There's no reason for a third person to be in the room unless one of the therapists really is unsure of their role or how to manage this, or they've never been through this. So it may be just a matter of educating them. Maybe one of the other therapists is CSAT or whatever, and they begin to explain. I can understand a therapist thinking, ooh, I don't know about this. I better get somebody else in the room. But I think that's more on the therapist than it is on the process itself.
Yeah. And they can get supervision, you know. You can get, Dr. Rob does a professional group every Tuesday morning so that therapists can come and learn more.
Free. I do a free consultation group every week.
Yeah. So there are resources for therapists to get what they need in order to be able to help you.
And if your therapist wants to write Tammy at seekingintegrity.com and say, I'd like to join the consultation group and ask some questions, Tammy would be glad to give them a password. They can come in. We talk about different issues every week. And we have about 20 therapists who attend, give or take 25.
Yes. Okay. So the next question, how does a sex addict learn what healthy sex is?
Well, I think you have to first stop having unhealthy sex. That's for sure. So I guess something comes to mind that I tell addicts a lot, which is, I think I need a lozenge or some tea.
I was going to say, I think your allergies are bothering you tonight.
It's okay. I'll make it. I'll just sound a little funky. Shoot, that was what I wanted to say.
Healthy sex.
Oh, right.
Stop with unhealthy sex.
I love this phrase. If I were you guys, I'd write it down. I think it's worth writing, but thinking about. For sex addicts, sex is about intensity. You know, we can't wait to get there. It's so exciting. That's new, that body, that experience, or it's really an exciting one. We haven't done a lot, or, you know, or if it is something we've done, it's just really, you know, scary and secret, whatever it is. But in a relationship, sex is about intimacy. So addicts often seek intensity when what they really want is intimacy. I want to be close. I want to be held. I want to feel important. I want to feel loved. But there's some reason why I don't allow myself to get that fully from my family, probably due to my past, or create a family that I can get that in. So when I really feel the need for love or attention or validation, I run to this behavior that will never give me that, but it will distract me for a short period of time. So I wanted to say one more thing about that. Oh, so healthy sex, understand, especially for men, right? Men are very visual. That's how we work. That's why we like porn. That's why we like strip clubs. We like visual and we like new. We don't like seeing the same old visual every week. That's why we like lots of porn, because it's always changing. So from a certain perspective, the intensity perspective, men want to see new bodies, young bodies, and we want to see different ones all the time. And if you keep feeding me that and I keep going out for that, then that's what I'm going to want. Every time I look at someone, sex is going to come from me out of, look at that butt, look at that body, look at those arms. That's what's going to generate my desire to be sexual, is the visual and the fantasy. Okay. I've been married 20 years. When I look at my spouse's butt, I don't think to myself, wow, that's amazing. I want a piece of that. I'm so sorry. I've seen that butt for 20 years. But when we lie together, when we're intimate together, when we hold each other, sex evolves out of connection and love. And what men are often surprised by is, oh, I didn't know I could get there unless I was already aroused, I have to be. And that's how we are as sex addicts. We're so lost and dissociated in the moment. It's like we're living in fantasy around sex, but really being with a person and having sex, that's terrifying to us. And so we just figure, and a lot of us in recovery, we're not that interested in having sex with our partners. We're not that interested in sex at all because it isn't bringing that intensity to us. And with a partner, we don't know how to do it. With a partner, it starts by holding hands. It starts by looking at each other's eyes. It starts by making sex fun and being able to laugh and have jokes. It starts by being vulnerable and open, and that's intimacy. It doesn't matter whether I get an erection or not. We're holding each other. We're massaging each other. We're loving each other. guess what? I got an erection. Ooh, we had sex. What a surprise. I wasn't expecting that. That's kind of how it goes. But if you're a guy and you're a sex addict and you're looking to your spouse to give you that same excitement that you had looking at porn or strangers, that's never going to happen. So addicts have to begin to move away from intensity and move toward intimacy. How's
Well,
that?
and that was great. And the other piece of it is, the building trust, having sex just for the sake of having sex. It really is about having that trust as part of the vulnerability. So, okay. So the next question, thank you, Dr. Rob, so much for your work. Curious of your sense of calling SLAA versus sex, romance, and relationship addiction, which I work with and clarify in my practice. Love both your books, Codependence and Cruise Control. Use them regularly. So, sex,
Can you
romance,
interpret that one for me?
well, instead of sex, love, addiction. So if you called it sex, romance, and relationship addiction instead of love addiction. So like
Okay.
changing the name.
Not my circus, not my monkeys. Not my circus, not my, is that what you say? Not my circus?
I do say that, yeah.
Not my monkeys. In other words, I have watched my field, and Tammy will attest to this, go through the naming game for 25 years. Should we call it addiction? Should we call it compulsion? Should we talk, is this really romance or love? I don't care what you call it. I just know what it looks like, and I want to help you, and others know what it looks like. So in truth, you're right. It is an addiction to fantasy and romance. But a lot of people think that's love. A lot of people think in the romance songs and the country western, all that stuff, and across a crowded room, and that's not love. That's a biological predisposition toward bonding. Love comes later, once you're already bonded. But if you think of love as being that intensity, that early, oh my God, they're all I can think about, then yeah, it would be okay to call it love addiction, because that person is in love with being in love.
It's a fascinating thought. I'm enjoying just contemplating that. And I think, we talk about intimacy disorders, like this all falls into the intimacy disorder, whatever way it is malfunctioning. To me, that's in that category. So.
Well, and I want to say something to you guys about this. I think it's a very easy way to think about it. Some of you won't like this, but it's my reality. It's the research. It's what I know. We are meant to be in couples. Human beings are meant to be pair bonded. That is what we're meant to do, whether we have children or we don't. And how do I know this? Because people who are bonded to each other in a healthy way, they live longer, they're more successful, they're more creative, they're more, on every scale of life, happiness, people do better if they're in an intimate bonded relationship. I know my life, my home is my foundation. And from there, I am able to leap out and do a lot of other things. I was successful before, but nothing like I've been since I've had this foundation of home. So let me say a little bit more about that. I think I lost the question.
Oh, I put it in answered. Sorry.
If you can wait, that's okay. What was the rest of it?
So it was about sex, romance, and relationship addiction.
All right. I think we got that one.
Yeah, well, that's what you're talking about. So, okay, you ready for the next one then?
Yeah, sure.
Okay. I have been in SLAA for a year and a half. My partner and I broke up 2 months ago. What work can I do for healing from cheating, betrayal, and distrust without having expectation of a reconciliation or having to work through it with the person who cheated? It seems that everyone in SLAA can only suggest no contact, and it feels like there is something missing in the grieving healing process for me. That's interesting. But I get it,
Well, I wrote an article about this once, and let me tell you, Tammy, where this comes from. I had a friend who was really having a miserable time getting out of her relationship. And she was talking about the recovery from losing the relationship. And she said, this is what I think. She said, I don't think I was really able to heal until I put all the pictures away, all the presents away, all the clothes. I had to take that out of my life, because until then I was kind of still leaning into touching, smell, and I sense from your question that you're still deeply connected to this person, and that's okay. But I think the missing piece, it's kind of like, can't I get to the grief by staying connected? And no, I think you avoid the grief by staying connected. I'll tell you about a relationship I had. There was a very meaningful, important relationship I had in my 30s, and probably the most intense love affair that I've ever had in my life. But ultimately, we were not able to stay together. We weren't able to work it out. And I'm looking for the end of that question, Tammy. Poor me.
It says it feels like there's something missing in the grieving healing process.
Right. So let me tell you about this. So I left this relationship because it was bad. It wasn't working, bad therapy, good idea to leave it. And then I waited, absolutely. And I know exactly how it was. It was 6 months thinking, oh, he's going to call me. Oh, well, he's going to figure out how much he misses. Well, he's going to, and all of my thinking was that the love was going to come back to me because this person was going to realize how important and special I was in his life and come back. And there was a certain point where I realized that, and of course we weren't talking. Once in a while I was sending a note, how are you doing? Once in a while, fine, but nothing serious. And I finally got, I don't remember what the reason was, that this person was not coming back. It was nothing they said. It was just like at a certain point I broke. I was not able to hold on to that hope that somehow it would work out because I wasn't getting phone calls. I wasn't getting notes. And this person wasn't saying, yes, let's make this work. Or in someone else's case, this person's so dysfunctional and so broken that you really can't trust anything they say. Grief starts when you really surrender the relationship on every level. If it comes back to you in some way, great. But for a period of time, you don't get to grieve until you put this aside. It's not that people are giving you wrong information. It may just be too painful to take it, which is you got to cut this out for a while and then grieve it. And then maybe be able to return as a friend or something else. But right now, like everybody says, and they're absolutely right, you need time out, focus on yourself, other people. And when you think about him, call a friend. Because your job is to grieve it, not to nurture it and try to make it work. It's over. And if you sit around thinking they're going to come back and they're not calling and reaching out, wait a little longer and the grief will hit you in the face. I was very sad.
Yeah, understandably. And it's grieving the loss of what you hoped for, not necessarily even the loss of what there was. Because, you know, if you broke up, things weren't all great. So it's like what you envisioned it could be or should be. So it's grieving on a different level than just the practical of this is what we had and I'm missing that.
There's even more grieving because if I'm used to being in a relationship, well, now I'm single. Now, you know, I have a whole different role. I don't have someone to answer to, someone to take care of, someone to take care of me. There's the loss of that, of being that person in this situation. So there's a lot of losses to grieve here. But as long as, if your reconnection to this person leaves you with any kind of fantasy about anything, and that I really hear in your message, you need to let it go. You just need to let it go. I don't have any other answers for you, and I know you want them, but that's the way it is.
So next question. I'm 16 months post-discovery, doing relatively well in recovery, SLAA step 3, and haven't broken my wife's boundaries for a few months. Things are on track towards a repaired relationship, I believe. However, when I compare to my peers who are in relationships, I see most wives and partners seem much more engaged in wanting frequent check-ins, etc. I don't see this with my marriage. My wife has often said that the main reason she wants to try to keep working on the marriage is because she can't imagine giving up the time with her children at all. She does once in a while admit that she loves me, and I hope that this grows over time, but I can't help wondering how this all fits within the codependence model when she is not so highly engaged in my recovery, apart from just wanting to make sure that I'm not cheating or stealing any money from her. I guess my question is around how can I apply codependence in this situation?
I don't think this is anything to do with codependence. I mean, I think this is someone, and I don't know who you are or what your situation is, but I think you need to look at the situation more honestly. This, it's really, some people aren't telling the truth. Some people do say what they mean. Some people aren't shading or manipulating or gaslighting. And your wife is probably one of them. And basically she's told you, I'm done with you. I'm here for the kids. I'm here for the stability. I'm here to make sure, probably they grow up and have money and they're not alone. They have their mom around, but I'm done with you. And believe me, she probably is. So I would sit around, again, I would not sit around hoping that she'll see you as a great father or she'll see you. I don't hear anything in what you've said that this woman wants to be with me. I heard that she wants the stability in her life she's had. She wants to make sure those children are okay. Maybe she wants to make sure they have a dad that's around, but anything between the two of you, I don't hear it. At least not right there.
Well, the only once in a while she does admit that she loves me, and so he has that, and I hope this grows over time. So,
well, I still love my ex-wife that I met 40 years ago, but it doesn't mean that I really want to live with this person. Loving someone and caring for them doesn't mean that you want to work it out with them. And besides, if I loved you and I saw you in a lot of pain, I might say, well, I do. I mean, who wants to be the cause of someone else's pain other than an addict? So, there we go. We don't either, but we end up causing the pain.
Next question. I have heard that SA is as difficult to kick as heroin addiction. Can you speak to the similarities and difference in the brain of the two addictions, although they may start because of the same things?
Well, a lot of addictions are about the drugs and alcohol that we use to create changes in our brain neurochemistry. It's not the alcohol that makes me drunk, it's what it does to my brain. It's not the cocaine that makes me high, it's what it does to my brain. And so here's the thing, we only have one pathway to pleasure. It doesn't matter whether you're eating cheesecake or having sex or smelling flowers or spending time with friends or doing drugs. Your neural pathways to pleasure are all basically the same. So the most pleasure that I can feel as a human being without taking drugs, no, it's not cheesecake. I know you thought it might be, Tammy, not even your cheesecake, but the most pleasure I can feel as a human being is orgasm. And that's it, without drugs. So the most compelling neurochemistry, the most powerful emotional experience of pleasure comes to us with orgasm. And I would say that means it could be addictive, just saying, just like cheesecake. But in any case, drugs and alcohol are just a little more of that. So when you put a substance in, it allows you to go beyond pleasures that you can feel without drugs. So to do meth, or coke, you just like, I'm great, I'm wonderful. But that doesn't really have much to do with how you're really doing or even what you're doing. If I'm having sex or eating, I expect to feel good. But just sitting around, probably not. But if I take drugs, I'm going to feel really good. So all I can really say is different drugs have different levels of what's the word? Addictability? That's not the word. People,
Dopamine hits, yes. Yeah,
different drugs cause different responses. And some people, by the way, love getting so high and so excited and so intense and they want to do things all the time. Other people just want to get plastered and layer, there's different kinds of drugs that people want to do for different reasons. But all of it is in the service of all of the using things not for the purpose they're there for is in the service of escape. So if I'm masturbating 5 times a day because the feeling of orgasm helps me disappear into some emotional cloud, or if I'm eating a pint or 2 of Haagen-Dazs or a quart every night because it makes me feel shameful and it doesn't matter. It's using these excessive ways to pleasure, whether it's drugs and alcohol or abusing the naturally occurring highs that leads us to addiction.
And I wanted to tag in on this because the difficult to kick. And like, I want to frame it a little differently because I feel like if you kick something, then it's like you never have to worry about it again. And addiction isn't like that. It's really recovery. I'm on a recovery journey. I don't live in my addiction. I live in recovery. But I always know that if I don't take care of myself and do the things I need to do, that I could tomorrow fall back into the same thing. So I just want to share that with you. So, getting on a sober path and then a recovery path is to me different than, kicking, just stopping something. So.
And I think, Tammy's point can be really well made by saying, some people expect that when you go to a treatment center, that the person's going to be cured. Because when you go get cancer treatment, hopefully you pray they're going to be cured. And if someone has a heart attack, you want that resolved and then cured. So we have this idea, but addiction is a chronic mental illness like depression or anxiety. It always is with the person. It will escalate under stress. It's much more like having diabetes. If I have diabetes, I'm going to get really sick unless I stay in a certain routine of blood tests. And it's really like that. I can be healthy and enjoy love and life, but I've got to do these things because I'm more vulnerable than other people are. I also wanted to say something about the find it, kick it thing that you brought up. There is no it. Like, I just love saying that. I was in therapy years and years ago, and this therapist said to me, Rob, I think it seems like in therapy, you're looking for it. And I think you have this idea that if you work on it, find it, work through it, that everything's going to be better. And there is no it, because this healing is a process. There isn't a place we land on we go through lots of major stages, but there's always more ahead of us. And it is a lifelong journey. So whether you think you're going to find it in therapy, like something that happened to you and then you're going to be all better, not true. Or if you think that you're going to somehow get it behind you and never want to crave again or have this problem, not true. It's a neurobiological problem that escalates under stress and can be maintained with a lot of support.
Thank you. That was really helpful. And go ahead.
No, go ahead. You're telling me nice things. Go ahead.
No, that was really helpful. And I have so many people go, like, I feel like if they just understood the why, then it can all stop. And I just go, that, like, you could read a million books and know, like, you could know why and you could still act out. So it really isn't just about the knowing.
And to that point, we run a treatment center. I've been working and creating treatment centers for 20 years. And, at Seeking Integrity, we do 3 things in treatment. And I think this is really what it's about. We educate people about addiction. When does it show up? What's it about? Where does it come from? We teach people not to go back to old behavior. It's called relapse prevention. So we had a lot of time in, if you feel like doing this, what do you do instead? How do you recognize you want to do this and what do you do instead? All relapse prevention. And the third part of what we do is help people understand how they got here and what their vulnerabilities are and why. And you do need to know that in good treatment, because for one thing, it's a lot easier to say, I'm kind of broken than I'm a bad person. And if nothing else, understanding that I got here for a reason, and it isn't because I don't like people and want to make people miserable and hurt them. It's because I don't know any better on some level. That's really a relief. But what I say to the patients in Seeking Integrity is, of those 3 things, relapse prevention, understanding addiction, and learning all about yourself and your history, what do you think is the most interesting and fascinating that everyone wants to know in treatment? And guess what they all say? What happened to me? Because who doesn't want to learn about me, right? How did I get it? But then I say to them, and what do you think is the least important thing? I'm sorry, let me try that again. So the most interesting thing is looking at myself. The least interesting thing on that list is relapse prevention, because it's so boring and rote and do this, don't do that. But then I ask them, what do you think is the most important thing on this list again? And the most important thing is relapse prevention, the most boring, simple thing, because it doesn't matter what I know about the past. If I'm in that situation and I don't know what to do or who to call or how to handle it, who cares if I remember that I was molested when I was 7? I mean, it's a good thing to know, but it's not going to keep me from the behavior. So insight alone availed us nothing, I think they say in AA. The insight is good. It reduces shame. It helps me understand what triggers me. But ultimately, I need to have a path toward living a life that doesn't lead me back to my addiction. And that's not the interesting part, but that is the most important.
That was brilliant. Thank you. So the next thing I'm gonna share, this person was with you on the, so we have a Sex Addiction 101 workbook work group online. That's a 6-week course, 90 minutes per session. And Dr. Rob guest lectured last Saturday. So this question comes from that. We have another group starting. It's just for men. There's another group starting July 1st. Happy to tell you more about it. Go ahead.
Before you go on, I just want to say, so where this comes from is that most of the books that I read about in our field, I found to be very therapy and complicated and not too many stuff. So a number of years ago, I wrote this book called Sex Addiction. I wrote a book called Sex Addiction 101, which is just what it is. It's a 101. I wanted something that if you were working with someone in recovery, you could say, here, read this book kind of thing. And then we decided that maybe there needed to be some kind of workbook that went along with that, because people, it's not just about reading, there are things you need to work on. So I wrote a workbook to go along with it, Sex Addiction 101. And since we really cannot provide therapy online, not yet, and by the way, anyone who's thinking, oh, I'll go to that intensive program wherever it is and I'll just do the whole thing online, it's not legal. We're not allowed to treat people from other states as much as we would like to, and some people are doing it, but it ain't legal. But in any case, what was I talking about, Tam? I'm going to lose the whole thing. Oh, so
about the workbook work group.
So we decided to divide up the workbook into probably 1 or 2 or 3 sections, and we're walking about 20 guys a week through this series, and they're getting to do the first part of the workbook, and then if they stay for the other part. So they're getting all of the kind of lectures and homework that we do in therapy, the thinking part, but they're not getting the therapy part because we can't do that online. And we did fill one group in June. I think we're going to fill another one for July, because people really want it's not enough to do therapy. It's not enough to do therapy. You need to understand, what does this mean? Why am I doing it? Therapy, I did it for years. I help people, but I realized that in residential and inpatient treatment, they also learn things. And while I was doing therapy for an hour a week, I could say, read this book or watch that YouTube, but it wasn't the same as me being able to give a lecture and walk through concrete things. So anyway, we created a program for that. And what is it, 6 weeks long, Tammy? Six
6
90-minute
weeks,
sessions?
90-minute sessions.
And so the second session, I volunteered to show up for it this week because I wanted to talk about denial, which is one of my favorite topics. So I want to set all that up for you, Tammy. So what's the question?
Well, and I want to add to that because I can't tell you how many people say, I got the Sex Addiction 101 book and workbook. And then I go, have you read it and worked through it? Because like just having it sitting on your nightstand isn't going to cut it. So having the structure of like, okay, I need to do this, it really helps the process as well. So,
and accountability. If you know
yes,
you're going to go back there and everybody else has done the homework and they're on to the next section, you know, you're going to feel dumb.
and you
By the way, I
be
just
done.
want to say one thing. I'm sorry about the series because this happened this weekend, Tammy. We're going to record all the lectures so that if anyone happens to miss one because they got having a baby or that they can go back and catch the lecture and catch up. You guys can't see it, but the person who signed up for the class can. I just want to tell you that, Tammy, because people were asking, how do I catch up? It's like, well, it'll be available to you if you need it.
Yes. But
so what's the question?
Anyway, so now that we've done all that,
Okay,
so this person was there on Saturday, and you spoke to us about a sex addict not standing up for myself because of the thought of running away and acting out after. Can you speak to this a little more? I try and be kind and understanding, and what I call rollover with no explaining or covering up. I'm confused. Am I setting myself up in the long run? So you must have been talking about like if you don't advocate for yourself in recovery.
I think what I was talking about was, and I actually, I don't know, I remember somebody wrote me about this too. Sometimes with perfectly good reason, our spouses and partners, they're so compelled to want to understand what's going on. They so want to understand really how bad has this been? How bad is it going to get? And can I stay with this person? That's what they're doing all the looking for to figure out if they can stay, you know, not by the way to check up on us. I mean, they're doing that, but they more want to see, is this someone who's so much going on that I can't stay around for? So in any case, what I think I was talking about was, I think a gentleman said, you know, my spouse, doesn't matter male or female, has been asking me questions about my addiction all day long, every day. Not 10 minutes goes by where I get it, well, where were you with this person or that? And where did you go? What did you do? And he said, and I keep thinking that if I answer the questions, that they'll go away. Like I'll answer as many. But the truth is, when you're with an angry, hurting spouse who hasn't known things, the more questions you answer, the more they're going to ask. And partners, again, are doing this to feel soothed, to feel like they know what's going on, perfectly good reasons. But it doesn't mean that someone gets to ask you those questions all day long. You can say, I want to ask your questions, I will ask your questions, but I want to do it in a safe way. So let's do it at this time every evening, or let's write them down and get together. But you kind of put a boundary around it. You say, I love you. I absolutely, you're right. I need to answer these questions as much as I can, but I'm not going to turn around every moment and say, put everything down, put the kids. And so we need to have some structure. And I actually feel that this helps partners because sometimes they feel a little out of control with everything. And it's like, okay, if I can sit down and talk about this 1 hour every night, or they have a structure around it, it's better for the partners and easier. So I think what I was doing, Tammy, was helping people to understand that they can set boundaries, even though that spouse may be feeling hurt or angry. There's also something else I think that is worth saying. I don't know if it's related to the weekend, but addicts are not assertive. We're not. Because when we get angry, when we get sad, when we get upset, when something's bothering us, we don't go to that person's situation and say, I want to work this out, or I feel angry, or we don't go to a friend and say something upset me. We go drink, we go use. We don't stand up for ourselves. We don't say what we need and want. We run away from it. And so, yes, I do think a part of recovery is being more assertive, standing up for what I need, not taking care of what I think everybody else wants, but sitting in my truth and being real. And that is very hard for addicts to do because we would rather run away than actually risk saying what we need and having someone let us down or disappoint us, or, you know, we just don't want that to happen. Hey, Tammy, do you mind if I talk about something else real quick? Because I know we're running out of time.
Yes, and we've got so many good questions, but go ahead.
I know, but I'll be on In the Rooms Friday if they want to ask them. They can write me at rob@seekingintegrity.com or you at tammy@seekingintegrity.com. We will answer questions. We'll send you referrals. We don't get kickbacks. We've just been in the field a long time. We know the people who are good and not. I do want to say something. I have a podcast. It costs you nothing, but we have almost 500,000 downloads. So I'm thinking we're getting there. And some of the more famous clinicians around the world who deal with intimacy, relationships, sexuality, romance, divorce, they're on there talking to me. I think we have about 70 hours of podcasts now. And people say it's kind of great. So I invite you to listen. Tammy and I have a new podcast called We're Healing Betrayal and Addiction. And that's her and I talking like this and answering questions. I hope it's fun. By the way, our podcast photo, I'll just tell you, is a Brady Bunch image where Tammy and I are kind of look to your left, look to your right now, Tammy.
Oh,
no, that's, yeah. So look like you're looking at,
I don't know if
wait.
I can see both of us.
Well, anyway, it's kind of like that.
It doesn't matter, so yeah.
And we do treatment. You know, I run a program that I think is probably one of the best in the country. It's not expensive. And it's very small and very intense. And it's taken me 25 years of work to do the best work that I can do. And I get frustrated when people say, oh, I have a great program and they've been around a year and they have great advertising online. But if you want to find your way to experts, I think you've got them with me and David Fawcett and Tammy, of course.
Well, you guys both work with every client that is at the program. It's a small program. You know, there's no interns. Like the level of expertise, I hear life-changing from the alumni. And what I care more about is when I hear it from a spouse or partner that means that the person took it back to their real life and there was a noticeable change. Like that's like, I get goosebumps when I hear those things.
And I want you guys to know that, you know, it's lovely to get patients, it's lovely to be paid, all of that. But if you listen to the two of us, I hope you understand how committed we are to people really getting well. And we've seen a lot of crappy programs go by. We've seen a lot of people pay a lot of money and not get very far, truly. And so neither of us want to put our names behind that. And I just
I don't want it to be the revolving door. Like we get a lot of clients who've been at other programs, you know. Right. If we're your first treatment program, we want to be your last treatment program too.
And I can say one more thing about like the way that, and this is just true, what allows us to do 14 free groups a week and endless podcasts and blogs and all the free stuff we push out is our ability to run a small program that pays pretty much for us to do all the free stuff. And that's kind of how it works. We figure we can help people on a very large scale, and the few people who can manage to make it to our boutique program, they pay for everybody else. So it's kind of like, I don't know what you call that, but it's a good political, I don't know, I like it.
Yes. So this is an important question. And
okay, let's do it.
Okay. I have a problem with objectifying women, and I sometimes dissociate or detach when I'm out and notice women. In fact, I am constantly surveying the setting I am in, and rather than being fully present with the person I am with, I am distracted trying to watch people and almost always notice attractive women. I have tried to stop this behavior, but feel very compelled to do so and feel like this is impossible. Also, I now feel very self-conscious because I think my wife is always watching to see if I am still practicing this, and I feel very awkward and unnatural. Are there any tools or strategies you would suggest that might help me manage myself when I'm out?
Well, this is a complex question to me. So I'll give you the simplest answer because this is what we do in 12-step program. If you were to go to a meeting and you raised your hand in SAA or SA or any of those programs, and you said, I'm struggling with objectifying people. I find myself staring at them. Sometimes I'm with my spouse and they notice it, and all the things you're saying. The simplest thing is we have a 3-second rule, and it's a really good thing. It's just something we have to practice. And that is, I'm walking down the street and I see someone's attractive and clearly I'm interested in them. For the first second of 3, I get to notice them and have feelings about it and say, okay, well, I'm a healthy human being and people are attractive. In the second, I look away and I don't look back. And in the third second, if you're a spiritual person, you can pray for that person. If you're a non-spiritual person, you can wish them well because they're someone's daughter, someone's mom, someone's sister, and make them into a human being. We have to train ourselves not to see people as objects. And this is the other part that I think is complicated. Number one, if you know how much this causes your spouse pain, why are you still doing it? Because I understand addiction and compulsivity, but you sound a little bit, no offense, you're kind of like, oh, I wish this were different. How do I deal with it differently? How much work are you doing? Are you going to 3 meetings a week and going to therapy? And, you've seen a doctor to see if you're obsessive compulsive. And how much have you put into this before you sit here and ask that question? If you say, I've been working on this for years, I've been going to meetings, I had meds, I've been to therapy or treatment, then I think you can stand up and say, why isn't this working? But I think if you've been to a few 12-step meetings, you would have already heard how we handle it. By the way, if you find yourself looking at people on the street, then you need to call someone in recovery and say, can we talk for a few minutes? Because I can't stop staring at people on the street. Some people have to call someone every 10 minutes. It doesn't matter. What matters is how willing are you? It's not easy. What do we say, Tammy? It's simple, but not easy.
Right.
You can make simple decisions to stop doing this. For one, you could deeply understand how much it hurts your wife and how insecure it makes her and how angry it makes her. She may be polite and just seeing if you're up to it, but believe me, she has feelings about it. And you're kind of, well, I'd like to make this better. How doesn't seem to me to really take into account how much harm you're causing in your own home. If you really got that, you wouldn't be saying, how do I stop? You would be saying, I've tried this, I've tried that, I've done this, I've done that, and I just don't hear that yet. So this is maybe not for you, but this is for the group. You know, when you're struggling with something, that means do more. Go to more meetings, go to more therapy, it isn't, oh my God, I'm not doing a good job, I shouldn't be doing this. It's more like, oh, I must need a lot more support than I'm letting myself get to change my behavior. So maybe you need to be at more meetings. Maybe you need to be therapy. Maybe you need to come to a treatment program. I don't know, but turn up the volume on what you need to do right. And this will come more naturally, is my response. Tammy, do you have anything about that?
No, I think that was great. And there are lots of resources, and Tammy, Tami at seekingintegrity.com if you want to.
You're a 4-letter word.
I'm a 4-letter word, and people remember that. So
Tammy, it's a great evening. It's always fun to do this. I'm sorry it's hot.
Likewise,
but
yeah,
it's nice to see you. And we'll do this again in a week.
Yes, next week, and Super Saturday Recovery Summit this Saturday. So join me there. So
and don't forget, there are 14 other groups on sexual relationship healing all week long. So feel free to
the
find
Old Lady
one.
Posse tomorrow morning. Men's group. There's a webinar Wednesday morning. Dr. David's on Wednesday night. Lots of stuff. Check out the calendar.
Great
Thanks,
to see you
everybody.
guys. I'm going to go eat dinner.
All right, sounds good.
Bye for now.